Hey, for anybody who is on already, if there's anything particular that you want to talk about tonight, please make sure you drop the topic down below. It is potpourri. We are going in tonight. So if there's something you want to know or talk about, drop it down below. Hold on, let me turn my TV off, y'all. Okay. Hey girls, hey ladies. I'm on IG and YouTube, so I'm gonna be looking back and forth. So don't think I'm crazy. I'm just trying to make sure I see everybody's stuff. And like I said, if there's anything that you guys, any topics that you guys want to talk about tonight specifically, make sure you drop it in the comments so that I can know. Okay. So, hey, girls. Hey, I'm so excited to be here. I'm a little bit tired. I don't know. Maybe it's a long weekend and I got to go to work tomorrow like we all do. But hey, girl. Hey, we're here. We need to talk. All right. So I'm going to wait for a little bit because it is really not 7 o'clock yet. And so for my girlies who are really waiting for the 7 o'clock, I just don't want to miss them with anything. Okay. So hey girl, hey to everybody. I hope everybody had a magnificent weekend. Girl, did y'all hear that it was another plane crash today about 3 hours ago in Toronto? So they were going from Minneapolis to Toronto. Child, a plane. Thank God nobody died, but the plane is on its head, like it's spinned on its head on the runway. Child drama. I don't know what we're gonna do. We're gonna talk about tonight, honey. We're gonna talk about a lot of stuff tonight. And I am so excited to talk to y'all. So excited to be on here with y'all. Y'all just don't even know or understand. I love talking to my girlies. Yes, I love talking to my girlies. And listen, y'all can, bring y'all men in here too, because we're not men hating. We're not men hating over here. And it's some stuff that I think that sometimes y'all dudes need to hear. That sometimes maybe y'all don't want to talk to them about. And so this is a safe place. So if ever I'm going live, just know that I ain't gonna be nowhere hating on nobody's man or anything like that. Okay, so one topic I have so far is intermittent fasting. I'm gonna talk about some stuff. I'm gonna drop some stuff, but I just want to make sure that if somebody has something that they really, really want to talk about, that we can do that. Thank you so much. I appreciate all of your thanks. Y'all, please don't think it doesn't go unnoticed or unsaid. I'm very I don't know. I don't know what this means, but it's very difficult for me to accept compliments. So I'm always like, thank you, thank you, thank you, because I see it as like my calling. I see it as something that I should be doing, something that I'm called to do, like my ministry. But I appreciate that what I'm doing and what I'm saying and what I'm trying to do is being received and appreciated by y'all. So at the end of the day, I appreciate y'all immensely. Okay. Anything that, oh, hold on, y'all. Hold on, Instagram. I'm throwing y'all around. Anything that you see that I do say that it can benefit anybody, please just get it out to them. Get it out to them, because we want to make sure all the girlies are in the know. Can we talk about weight loss medication, Zepbound? What's your thoughts on these? Yes, ma'am. So we'll talk about the GLP-1s. We can absolutely do that. Okay. How long should it be on birth control? Oh, there's no real one answer for that. But we could talk about it. I want to talk about older women who want to date younger men. Okay, girl. Okay. My soap in menopause and premenopause. Girl, we could always talk about that. Anything I'm missing up here? Yeast infections, antibiotics ineffective. Okay, yes. We can do that too. I'm trying to catch it all. I saw somebody else with this whole depot and brain tumor thing. One of my patients brought that to me. So I'm going to tell you what I know. This is something altogether new and different. Okay, fibroids without surgery, honeymoon pill. That might be like a new name for something that. So explain the honeymoon pill, like what it does, and then I can tell you what it actually is. But y'all be coming up with new names for stuff. I'd be like, wait, run it one more time. Okay. I like how you're bringing yes. Okay, y'all. How to get a prior authorization for approval, medications up to sleep. Okay, child. Prior authorization. Oh, child. Y'all see me about to lose my life over here trying to reach down and get this pen. Okay. Child, prior authorizations, child. Okay, so let's get started, hunties. Let's get started. Okay, so first of all, for anybody who's new to my channel who does not know me, I am Dr. Tasha Rogers. I am a board certified OBGYN. I practice here in Atlanta. I own my own practice. For anybody who's asking, yes, I'm still accepting new patients, but we got some rules, y'all. Yes, I do see out-of-state patients. Initially, I like to see you, put my hands on you, get a feel for you initially at the first visit. But then after that, depending on what the situation is, we can always do telemedicine. And go from there. So, and we'll be face to face on a computer just like we are now. So that is always an option for all of you guys who are asking. As far as insurances, I don't know. Y'all got to call the office and figure out. And this, so many changes are happening so fast. So it's a situation where I might have been accepting a new an insurance 2 weeks ago, and this week so much is happening, y'all. We got to dig in. We got to dig in. Okay. So, first of all, I personally want to give a, not condolence, but I want to give my heartfelt, sadness for anybody who knows someone who was on that flight today or had a family member on the flight today or they themselves were on the flight today. I'm so happy that everybody survived. And hopefully, the skies will be getting friendlier real soon, because right now, run me a rent a car. Run me a rent a car. I know what the statistics show. Run me a rent a car. Okay. Or let me walk. Okay. Strap something on my back. I'm like Charlie Brown with that little thing on the shoulder. I'm going to walk, or I'm going to get me a rent a car. And book accordingly, because at the end of said day, sis, okay, I'm scared to fly anyway. If you know me, you know I'm scared to fly. But these skies ain't so friendly. So miss me with a flight. I'm just saying, it is what it is. Now, I do want to share some things with you guys. You know that my primary purpose on coming on and being on with you guys and doing the videos that I do and all the things, is that I want to educate you guys. I want to educate you guys, but I want to educate you with real life information that is accurate. And hopefully I'm encouraging you guys to go and read some stuff, look for some stuff, but don't go on. And this is no offense to TikTok. I'm not a hater of TikTok. I love TikTok too. I like TikTok too. It's just too much going on. The sounds, the music, the videos, the stuff scrolling. It bothers my anxiety. But nevertheless, the point is that I don't have anything against TikTok. But if you guys, I want to encourage you to start going to sites like the National Institute of Health, the CDC. When you look for stuff, look for credible websites. Look for credible organizations, your .orgs, your .govs, who have written about these things and talk about these things, not your chat sites, not your, I think we sometimes have such a thought of, they're going to try to hide it from me, so I'm going to look in the least likely possible place and find the truth. Not so much, and we can kind of get into that as well. Okay, so yeah, that part. But I want you guys to start advocating for yourselves. That does not mean you have to go to the doctor's office and yell and scream. It doesn't mean that. What it means is, when you go to the doctor's office, I need you to be a little bit prepared. I need you to be a little bit prepared as far as topics are concerned. Okay. And wait a minute, hold on, because I saw something that I need to address. My child passing, that it's not unique to white women or black women, Hispanic women. No, definitely not unique. I'm gonna get back. So anyway, I want you guys to be prepared. Meaning, when you go and you have an issue or a concern, read a little bit about it. What happens? What could it be if I have right-sided pelvic pain? What are the things that I should be asking the doctor? What are things that I need to be mindful? Okay, have some kind of concept of what your issue is. And it's a shame that we have to do that, but we do. This is where we are in this day and age. We have to do that. Oftentimes, I had to take a family member in for medical care today. I did not tell them I was a doctor. Did not tell him I was a doctor. And the reason for that is I kind of want to know what you know. Like, I know what I know. And you don't need to know what I know, but I do need to know what you know. And sometimes, everybody's not going to have the benefit of being able to go into the doctor's office with a doctor, but you do have your sense, and you do have your intuition and your instincts. And I want you guys to start using that. If you get the intuition or the instinct that something ain't right, and this person don't know what they're doing, and they don't know what they're talking about, I need you to go with that. Okay. We are in a situation, and again, if I offend anybody, that is not my intent. I am speaking my truth. It does not have to be the truth. I am speaking my truth. Okay. We are in a day and age where, prior to like the 1990s, healthcare and medicine in general was not for profit. Now it is very much for profit. So you have hospital systems who will hire your mid-levels, your nurse practitioners, your physician's assistants instead of physicians. And that is problematic. I love the mid-levels. They do what they do great. I think it's even a disservice to them when they are put in a position to act as doctor, because that's not what they were trained for. And the level of diagnostic training is different. And, yes, you get some doctors who are far worse than the PA, but the reality is, if everybody stays in their lane, then the job can get done. These health systems, they don't care. What they're going to do is they're going to hire the cheapest person to give you whatever random answer, and then that's going to forward you to their specialist. And, then it just turns into a whole shitstorm. And that's what we're seeing in medicine today. And so please, I try and employ, read a little bit, advocate for yourself. Half of us on here, we going to investigate the crap out of our hairstylists. We're going to have 30,000 nail pictures in our phone because we're going to let our nail techs know what we want. We're going to have it all down. We're going to be ready. We're going to be looking at all these websites to try and figure out our birthday outfits. But if somebody asks, like, what about this and what about that, and this is a condition that you've been diagnosed with and you have no idea about it, that's problematic for me. Like, we got to start, keep what's important important. You know how they say it ain't what's on you is in you? Yeah, we got to know what's in us. Okay. So we got to get on these things, guys. And it is very, very important. Now, I did see somebody, you guys know, because everything I do fixes a problem. Nothing I do is just to sell something, right? None of my products are just to sell something. Every product that I make, and I make everything by hand, by the way, every product that I make, it solves a problem. Everything that I do, or I put my hands in, or that I push over to you guys, it solves a problem. And so I just wrote a survival guide. I call it a survival guide, and it's called A Black Woman's Guide to Surviving Pregnancy, Labor, and Delivery. And I do have somebody who just said something that's put, my child passed, and I am immensely sorry for your loss. Trust me, my child just recently passed, my fur baby. So loss is, and I don't equate it, but I am sorry for your loss. I understand. Okay. And it is not unique to white women, Black women, Hispanic women. It's not unique to anybody, okay? But please understand that disparities in healthcare, which increase the rate and the risk of loss, is unique to Black and Hispanic women, especially Black women. The CDC just did a study that the information was from 2023. And I want y'all to hear this, because it's not just about pregnancy, although it's about pregnancy. The CDC just released a study, and it said that across the board, y'all, I'm trying to catch up. Give me a second. Across the board, that morbidity and mortality, maternal morbidity and mortality, meaning what's happening in the hospital, what's happening on labor and delivery, maternal morbidity and mortality has decreased across the board for every race except African Americans. Ours has gone up. Now, I have my opinions, I have my thoughts, and I'll share them with you because you're on my live. I'll share them with you. I feel like some of it is us. Some of it is us. A lot of it is the medical community not really giving a damn, because what are we going to do? We're going to march a little bit. It's going to be on the local news. Um, it's going to be on the local news. They're going to hire that Elma D. Fudd attorney, and nobody's ever going to hear anything else about it, because the little bit of money that they give you for the loss that you've endured, which no amount of money can compensate, the loss that you've endured, part of that is non-disclosure. And so nobody ever truly gets to know um, how awful these health systems are being to people. That's the first part. So what I'm trying to say is Black women are amongst the lowest on the totem pole as far as equity is concerned, and they kind of just don't care. Oftentimes, and I have read this in the book, I have written this in the book, that oftentimes, because culturally, and I always say, if you don't understand the culture, you'll never be successful at treating the patient. If you don't agree, that's fine, but I'm just telling you. So, um, you know, we're so emotional sometimes because we feel like we're being wronged, because so many times we have been wronged, and so we feel that so strong, right? And so we're so emotional about it sometimes. And this is what I actually put in the manual: once you get to labor and delivery, do not let the message get lost in the messenger. And so it's easy to be like, she ignorant, she's rude, she's ghetto, she's abrasive, put them out, get them out of here. And the fact that you were right the whole time, but how you presented it, unfortunately, even when you were right, played into the fact that you were ignored. Okay. And so again, in that manual, I put how to combat that, how to alleviate that. What happened? So it's a lot that goes into, unfortunately, it's kind of one of those, how do you conduct yourselves in a particular situation? And you like, I shouldn't have to go through. You're right. We shouldn't. But unfortunately, we do. And so I tried to put together something to let you know, to see from the eyes of an insider what is being said, what is being seen, and how it's being perceived. So at the end of the day, if you know a woman, if you are a woman, if you're a childbearing woman, if you're thinking about having a baby, if you're currently pregnant, if your wife is having, it does not matter. Get this damn survival manual, because what do I say at the end? Once you're going up the chain of command, if all else fails, please, please, please have your attorney at your bedside. You can do that. Call legal counsel to your bedside. And it's kind of like instruction on how to do that. Like I said, y'all doing all these pregnancy photos and all these $500,000, baby showers. Slow down, pull back, give an attorney $500 to say, if something goes to the left during my delivery, that they will come and be your eyes and ears at your bedside before it's too late. Okay. So there's so much useful information in that manual, and I pray that you guys will get it. It's on drtasharogers.com. Now, let's talk about a little bit medicine and the political climate. I'm not going to talk politics. I'm not doing that. I'm not doing that. I got to protect my peace, and I hope you got to protect yours too. I'm not doing it. But what I will tell you guys is that medicine follows politics. Okay? Medicine follows politics. I need you guys to understand that. When it looked like a lot of stuff was happening. And again, especially, I don't know what the attack is on women's health, but it's a hell of an attack on women's health. So my patients who were getting birth control now can't get approved for birth control. There are some medications or some things they will write back to me. Why do you want to use that? What? Because it's indicated. So please know and understand that medicine follows politics. Because we're getting rid of a lot of our regulating, how do you call this, like organizations, you guys are going to start running into problems. And it's been happening here in Georgia for a minute, because this is a good old boy state. So Atlanta is the blackest city in the country, but the state, go 15 minutes outside of Atlanta and see what happens. The state is not like that at all. So a lot of what has been happening is your insurance claims are getting denied. And who you gonna go to? Who you gonna complain to? So you pay your premium. They don't pay me. It ain't really I don't really care. I don't really care. Okay. Who didn't pay? I just know that you got a balance on my books. And no offense, but I got bills just like you got bills. So you come in, oh, they didn't pay. Okay. And sign up for the, no ma'am, no ma'am. Until that bill is resolved, you can't see me. And I don't think that's unfair. You know, I don't come to work every day to work for free. I would love to. I'm not independently wealthy. Now, once I get wealthy, I might do some pro bono stuff and be seeing y'all ladies for free. But until that time, the girl has to work. Okay. So what that means is, who do you guys call? So you've paid them your premium. They haven't paid me. You're at the doctor. So now your doctor hasn't been paid. You can't see the doctor, but you paid your premium. Who you gonna complain to? So I need you guys to very much be in a space of taking very good care of yourselves and being very, very astute to what's happening with your bodies and knowing a little bit when you go into these doctor's offices, because it's about to get worse before it gets better. I'm just telling you, okay? So just pay very close attention to what's happening, okay? Now, a couple of other things before we get into actual topics that I really kind of want to warn you guys about. I want to warn you guys about doing too much but not doing enough. Okay. What does that mean? A couple of keywords that I need y'all not to get pulled into. First thing is natural. First thing is holistic. Next thing is vegan. The next thing is, I don't really know, all of these little key chomp words. Nothing's wrong with it. And before anybody's like, oh, y'all doctors, let me be very clear with you. I love holistic medicine and herbal medicine and Asian medicine in its proper perspective. Okay. So, like I said, when you guys are learning some stuff, be very careful, because what's going to happen is, and what frequently happens is, people will throw these keywords hoping to bait you and grab you. One of the things that I always say at my practice, there are two things. I'm like, if you can tell me why you're taking these supplements, I'm not going to bother you. I'm not going to bother you. If you can tell me what it does and why you're taking it, I'm not going to bother you. But when you say they said, who is that? And if you heard it on TikTok, where if you heard it from somebody who was trying to sell you the product, I automatically want to hear it. I do not want to hear it, including some of these well-known OBGYNs who are on the trying to sell y'all products. They have brand deals. They have brand deals, and their job is not to fix you. Their job is to get paid and do a convincing ad and commercial for their brand deal. Let me be very clear. Okay, because some of this, I'm like, what is this? People bring it to my office. I'm like, what the hell is this? What is this? Okay. So at the end of the day, just be very careful as to what you see here. Take herbal medicine, Chinese medicine. I'm not that well versed on Chinese medicine, but when it comes to herbal medicine and holistic medicine, I will tell people in a second, it is for prevention and it is a supplementation. And so what does it mean? Let's say you got high blood pressure, right? You got high blood pressure and your doctor says, hey, you got high blood pressure. Well, again, they put a bunch of terrible ass doctors in our community and bastardize you into thinking that bad behavior, meaning eating pork, eating salt, and gaining weight, as well as being in traffic and having coffee, has raised your blood pressure. That is not true. So because of those erroneous thoughts, you feel like if I fix my behavior, then I won't need blood pressure medicine. That too is not true. Blood pressure is mostly genetic. That means, what does it mean? That means that your mama got it or your daddy got it, which means that at some point you're going to have it. It just is. I don't have it yet, but my mommy has it, which means that I'm going to have it at some point. Okay. 9 times out of 10. Now, what you do get to control is how severe it is and how soon you get it with your life habits. But 9 times out of 10, you're going to have it. You know, I had a trainer one time. That was when I was training. Don't say nothing smart, y'all. I had a trainer one time, and the trainer was on 3 different blood pressure medications, and her blood pressure still wasn't well controlled. She was vegan. She worked out all day long, and she took her medication. So it wasn't lifestyle. It's genetics. Let me be very clear. Okay. And the thing is, and to get off the topic, the thing is that we be like, oh, I'm going to take me some wild yeast. What is it? red yeast rice, and I'm gonna take me some garlic, and I'm gonna take some of this, and so omega-3, and I'm gonna take all this, and I'm not gonna need, and I'm gonna change my life, and I'm not gonna need the blood pressure medicine. Well, I don't have any issues with your supplements, and I don't have any issues with you changing your life, especially if it's for the better, right? But the reality is for every day your blood pressure is elevated, you are killing your kidneys. You're killing your kidneys. Why do you think there's a dialysis clinic on every corner in the hood? Because they know that's going to be our behavior. So what I would tell people is don't be so I don't want any medication. Why? If it's keeping you alive, if it's keeping you healthy, don't be pressed on the medication. Be pressed on your lifestyle that keeps precipitating the medication. How about that? But nevertheless, what I tell my patients is take the medicine. Take the medicine. But if we're going to change our habits, we're going to start walking, we're going to start drinking more water, we're going to change our diet, we're going to decrease our weight by the fact that we're adding in physical activity, your pressure is going to start to drop. When your pressure starts to drop, that's when you talk to your doctor about, hey, look, my pressure is getting lower. I need you to drop my medication. All the while, yes, you can take your supplements. Absolutely. Your pressure continues to drop, then you continue to drop. And if getting off the medication is your goal, that may be a possibility, right? But at the end of the day, your goal should be to protect your kidneys at all costs. I don't care what it takes. I don't care what you got to take. Protect them kidneys, baby. Protect them. Dialysis is not where you want to be. I promise you that. Okay. So that is how you have to think about it. It has to be like a supplementation type of, let me add this to what I'm doing. This is going to be the icing on the cake. This is going to help my pressure get down faster. This might help me get off medication, but please don't use one instead of the other. Okay. So that's when I say people are doing too much and not doing enough. Well, no. I'm going to go take this herb because Dr. Sebi said, and I'm a believer of Dr. Sebi. Let me say that to you too. But Dr. Sebi was in the villages of Honduras. He grew his food. He knew where the food came from. The water was fresh. The water was clean. He didn't have the pollutants that we have. So the rules were a little bit different for Dr. Sebi and his crew, okay, than it is for you living in Metro Atlanta with all the foolishness and all the nastiness and all the hard water. You can't even take a shower without a coating of something white on your skin. So I'm just saying that, and let me leave you with that as far as it's concerned. So I'm not saying don't adopt herbal medicine, believe in herbal medicine, understand herbal medicine, even get into Asian medicine, acupuncture, all these things, but they should be used in conjunction with. You heard me? Okay. All right. So that is what I want you guys to do. Please just don't be jumping on these labels and be like, it's vegan. Oh, girl, let me get me some of that. I tell patients all the time, holistic, organic, vegan, non-GMO. It describes cocaine as well. It just ain't a good idea. You see what I mean? Don't get so wrapped up into the thing. Keep the central thing the central thing. Don't get wrapped up in these labels. And again, 9 times out of 10, if somebody is selling you a bill of goods, like, no, don't listen to these doctors when they say this, that, and the third. They crazy, because let me tell you what you can do, and this and this, and this how the kidneys really work. And then now take my supplement for $90. Say, okay, I respect that. I hear that, but just let me go learn a little bit on my own. Anything you need. And again, if there's somebody out there who cannot read, yes, there are still people out there who cannot read or cannot comprehend what they are reading. Find no shame in being like, girl, what they saying here? Because I don't get it. It's okay. Even if you gotta be like, I ain't got my glasses, it's okay. But get understanding. That's what we need to be focused on, getting understanding. Black women, we spend so much money, and half the time we're getting duped. Let me say this before we get to the topics, because we're about to get to the topics. The one thing that I really just want to rip somebody's damn face off about, and not my patients when they come in the office, it's more what they've been told. So what they've been led to believe. Probiotics. First of all, probiotics, prebiotics. To be perfectly honest, I'm not 100% sure on the difference. I do realize that it's probiotics and prebiotics contain different things, and some break down in some parts of the gut, because in some parts of the gut, they're susceptible to some particular bacteria, and other parts of the gut is susceptible to other bacteria. So your probiotics and your prebiotics, essentially, I think it just differs where they break down and what they contain, but it's all for the same good, to keep a healthy balance of bacteria in the gut. Did you hear me? The gut. I don't care who say what about what. I don't care. There is no such thing as a vaginal probiotic. I said it. There is no such thing as a what it's going to do. What somebody break the science down to me. Somebody break it down to me. You know, it's so funny. Somebody, girl, it just please. Healthy vaginas are healthy vaginas. Healthy guts are healthy guts. And I think what they try to do is say, okay, here's how this is going to happen. If your 80% of your immune system lives in your gut. So I think their logic was, oh, if we keep the gut healthy, then we can keep the immune system healthy, which will then help the vagina. Well, it ain't going to hurt the vagina, but it ain't going to really do a whole lot to help the vagina. I mean, because, at the end of the day, yeah, don't even get me started on it. But yeah, my patients come in, oh, I take for what? You better be taking it for your gut health. You better be taking it to have regular bowel movements. You best not sit up in my office and talk about no vaginal probiotic. Girl, who? Child, who? I don't care who sell it. I don't care what she said. I don't care about none of all of that. If somebody can break down the science to me on how it works, cool. But if you can't, no, ma'am. It's a supplement you're just trying to sell. You jumping on the bandwagon. And they have made billions. They have made billions. I doubt that they've helped any. Because all of y'all who are on the vaginal probiotics, stop taking them tomorrow. If they truly fix something and they have fixed a balance of whatever you calling yourself having an imbalance of, stop taking them tomorrow. I bet your problem come back. I'm just saying. So, okay. So y'all threw a lot of topics at me, right? What do I recommend? Supernova girl, actually, what do I recommend? Girl, have you been watching my videos? I told you about hygiene. I told you how to have a healthy vagina. I done educated you about vaginitis. Girl, you got to go back and look at the stuff. You might be new to the channel, honey. But okay. So let's start getting to some of the topics. And some of the topics were duplicates. So a lot of what you guys want to talk about is menopause and all the things. And again, I want you guys to do know and understand that when I'm speaking, I speak on a whole. Somebody's like, well, my doctor is this color male and he's great. I'm so glad that you found somebody that you gel with that is taking great care of you. No, and let me be clear. No, not every Black doctor is going to be great. Trust me. Not every white doctor is going to be bad. Trust me. So the reality of the situation is these are generalizations. And I truly am one to feel like if somebody understands the culture, they will understand why and why not you do certain things, right? But the reality is it still comes back to their skill set. So I think everything mixed into one has to be it. So never ever think that I'm on this channel downing any doctor that's not African American or big up in every doctor that's African American, because honey. And also understand that everybody with brown skin ain't African American, which again puts us at cultural divides. So somebody can have brown skin but be from a totally different culture, and they are no more sure as to understanding you as somebody else with the whole lighter color skin or so please don't feel that I'm generalizing all people into all baskets. I just want to be very clear on that, because my thing is making sure that people get good medicine. I don't give a darn who gives it to you. So if you have found a provider that hears you, you feel heard, they are fixing your problem, they make you happy. When you leave, you feel as though you have been serviced, then that is who you need to be with. Got it? Okay. Now, somebody asked the question. I think this is a very easy one to deal with. So I'm gonna hit this one first. Somebody asked the question, how long should you be on birth control? Well, it depends. And it depends on what birth control you're on. To be perfectly honest, birth control actually has a huge amount of benefits depending on what birth control you're on, depending on what medical conditions you have, depending on your age. Let's say it's a birth control pill. Birth control pills are amazing. They preserve your fertility. They protect and prevent you from ovarian cyst. They decrease your risk of ovarian cancer, endometrial cancer. They also make your period shorter, lighter, and more comfortable. And so they're actually great, but I don't keep any patient of mine on birth control pills over the age of 40. And you're pushing it at 40, because at 37, I'm like, girl, we got to come up with a better plan. Depo-Provera, I'm not a fan of Depo-Provera. Some people love it. I'm not a fan of it. And the reason that I'm not is because while you're on Depo, you are losing bone mass. Now, they say that once you stop the Depo, the bone mass will regenerate and it will come back. But they're like, oh, just take calcium supplements. Well, how do we know the calcium supplements will keep up with the bone loss? And I just feel like with so many other methods of birth control, why we got to lose bone mass in order not to get pregnant? Like, it's a better way. Like, I just don't feel like I feel like whenever you take something, I feel like the benefits should outweigh the risk. Now, if you are a patient that has lupus, if you are a patient who has sickle cell disease, not trait, sickle cell disease, then Depo is going to be the best method of birth control for you. So it really does depend. But as far as Depo is concerned, like I said, the sooner you can get on it, the sooner you can get off of it because of the decreased bone mass. Cool. I love that for you. I'm not a fan. Depo is the only birth control that's associated with weight gain. No other birth control is associated with weight gain. Maybe back in the day, if you in my age group, we was on that Orthonoval 777, honey. You was walking around, your hips spread, your boobs got big, your grandma swore you was having sex, honey. That was just a time to be alive, girl. But birth control has changed dramatically since that time. And then you have the IUD, where no matter what kind of IUD you have, because doctors will dupe you into thinking, oh, you want the non-hormonal, okay, then you need to get the Paragard. Well, first of all, Paragard, which is the copper one, is going to make your periods longer and heavier. And outside of that, when you have the one with the hormone, which is the Mirena, Kylena, Skyla, Liletta, when you have those, the hormone that's in them, which is only progesterone, it's not the estrogen, it's only progesterone, it stays on the lining of your womb. There is no hormone circulating in your bloodstream when you have an IUD, or at least it shouldn't be. But that all goes to placement. And so that is the doctor's thing. Like, was it placed properly? I'm going to tell y'all one thing I don't like. I don't like having a double check myself, worry about anything. So anybody who gets, and it might be overkill, but this is how I practice. Anybody who gets an IUD in my practice, they get an ultrasound to confirm placement. Once placement has been confirmed, 9 times out of 10, you will never have an issue with your IUD. I've never had to pull an IUD that I've placed because it was embedded, because it was placed wrong, because never, ever, ever have I had to do that. Now, I have ultrasounded one and was like, I don't like it. Come in, I'm going to pull it out and I'll put another one back in under ultrasound guidance. So, I just make sure I follow it into a comfortable place, and then my patients are good. So it depends on your age, it depends on your medical conditions, and it depends on what birth control you're actually taking to determine whether or not, or how long you should be on birth control. So that's not really a direct question. It's more of a personalized question. And I'm hearing one of my patients came in and told me, because I really hadn't read this, and I hadn't seen it anywhere. Medical journals be slow to put stuff out, but that there was a case associated with a brain cancer and Depo. I hadn't heard anything about that based on the fact that Depo is just progesterone. I don't necessarily see the correlation, but that does not mean that there is no correlation. Half the time, we don't know about side effects until people suffer them, right? So can't really answer that as far as how it goes. But again, I personally feel like there are much better methods of birth control than Depo. If it's all you have for your particular medical condition, then I would definitely say, hey, do it. But again, look into an IUD, because again, there's no hormone circulating in your bloodstream at all. That IUD is really just working on your uterus. Your period is actually controlled by your ovaries. You just bleed because of and through your uterus. But I would definitely say look at that or discuss that with a provider. Okay. And that's as far as the birth control thing goes. Somebody asked about how they go about getting a prior authorization for a medication. Let me just explain you how these prior authorizations work. I spend so much time doing prior authorization because I love y'all. Because otherwise I'll be like, no, ma'am, I'm not doing this. It really is not us. We send the prescription over, and everything is usually done electronically, right? So we send the prescription over. The pharmacy will usually kick it back electronically and say this person needs a prior authorization. The prior authorization, again, comes up on our computer. It'll ask us a couple of questions depending on what the medication is, just to make sure you are you're able to get it under the insurance company rules. The insurance company looks at it and then says yay or nay. It has nothing to do with what we put on the paper. We can only put the truth on the paper. And at the end of the day, they ask us the questions. It's not like we formulate this and say, oh, my patient no. They'll say, how old is the patient? What's the BMI? Why is she getting the medication? Has she had this before? Has she had that before? Has she had this? Boom, no. And then it's nothing we can do. Unless they say, oh, do you want to fight it? Do you want to appeal it? Well, the same people you're appealing it with are the same people who made the decision. So if I say, yes, I want to appeal it, then that means I got to sit on the phone on hold for about a half an hour. And then once I finally get somebody through to the phone, they're really not going to be looking at your case anyway. I literally did an appeal one time, and whoever I was talking to, nurse, doctor, whoever they was in their phone, in their car, child, in their car. I could hear the traffic passing. So obviously your chart wasn't in front of them because they were in their car. So they listened to everything I had to say and was like, okay, we'll give you an approval or denial in the next few minutes. And of course, over the fax, a denial came, which means they weren't listening to me at all. They weren't looking at your case at all. They were just taking the call because they were paid to take the call and they were planning on denying it anyway. So that is how prior authorizations work. It is nothing that we do or don't do. They send us the questions, we answer it. And sometimes they'll say, send us a copy of the chart. Oh, she's overweight. Send us her vital signs. Oh, what did y'all talk about? Oh, y'all talked about this at the office. Send us a copy of the note. Send us a copy of her labs. Like, they literally want proof of what they're asking you. And if you can provide that, sometimes it works in your favor. Sometimes it does not. So, girl, that's how prior authorizations work. Ain't got nothing to do with us. The pharmacist was like, your doctor didn't do the prior. Girl, sit down somewhere. Sit down. It has nothing to do with us. We can do the prior authorization. They literally have, as long as they want to respond, and how they respond is how they respond. And there's nothing we can do about it. So sorry about that. All we can do is try. And I have to be honest, when you get somebody like me who owns my own practice, I get to work at my own pace. But when you have somebody who works for a practice or works for a health system and they have about 50 patients a day, girl, your prior authorization ain't getting done for a minute. Just let you know. Hate it for you, but that's just how it is. And a lot of times that's why insurance companies do that, because they know nobody's going to take the time or have the time to go in and do all these prior authorizations. And sometimes prior authorizations are 2 or 3 steps. You'll send one back 15 minutes later, now they got 5 more questions. 15 minutes later, they got 5 more questions before they do the approval or denial. So a lot of times, a lot of practices will not take the time to do it. And I mean, they just won't. Or they'll say, well, let me prescribe something different. Or if they do, it can kind of get caught up in paperwork limbo. Because I've seen sometimes when we send it back and the insurance companies just don't respond. And then they'll send a denial letter saying, your doctor didn't send us the information. Use a Donald Trump lie. That paperwork was attached to that prior authorization. I know you lying, but that's what they do. And then we try and redo it. So, we'll go from there. But anyway, so there's that as far as the prior authorizations are concerned. Now, I thought this one was a good one. Somebody said, an older woman dating a younger man. Can I talk about it? Yes, I could talk about it, honey. I think it's cute. I think it's adorable. I think there are some things, there's a checklist that I would give you. You ready for this checklist? All right, sissy. Go ahead, mama. Go ahead and get your little pen out, because I know she says she's 64. Go ahead, girl. And I know how y'all don't be doing nothing on the phone. Y'all write everything down. Y'all pay for everything with cash. Y'all want all y'all paper receipts. I know, girl. So go ahead and get your piece of paper. I'll hold on and wait. And we can go. They are always saying they code wrong. Yeah, they always say they code wrong, honey. It's only the medication will literally tell you what to code. We only accept this code or this code, and then they'll kick it back and say, oh, it was coded wrong. But 9 times out of 10, that's going to be customer service who says it was coded wrong. Here's the thing: customer service have a script. Customer service is at home and in their kitchen. They actually have a script. They don't have, and I learned this from some like executive at an insurance company once. There was a whole issue at my practice. Customer service does not have access to they don't have access to the billing. They don't have access to your actual they don't have access. They don't know. They're reading from a script, and then they get you all riled up to call the doctor's office back so y'all can argue, but they have no idea what they're actually talking about, by the way. So, okay. So grandma, I meant somebody's grandma. I ain't saying you my grandma, because you ain't that old sissy, but somebody's grandma. So let's get you squared away, mama. The first thing that I want you to do is to know, honey, that you got this, and yes, and you don't need to feel guilty. You date who you want to date, whether he 44, 34, 24, 84. Do what you got to do. Okay, make yourself happy. That's the first thing. Next thing is I need you to have enough gumption to be like, so when's the last time you was tested for all the STDs, all of them, and not just take their word for it. You need to see the paperwork. What can I see the paperwork? Just so y'all know, and this is for everybody, not just my mom. There are fake my chart results floating around. I got all the negative stuff on, and I think they do something and can change out the name. Yeah, if he says, "Oh, this is my chart stuff," make him log into my charts because he should be able to log in. You'll be able to see his visits. You'll be able to see what he was tested for. But if he just coming up with just regular old, look, here go my chart. Nah, we're not doing that. Log in. Okay. And so make sure y'all are seeing these results. And this is not just for my mom who is, outside, honey. This is for everybody. So just take note to this, y'all. So outside of asking to see his results and not letting nobody, y'all will ask, I asked him and he didn't give it to me. But you still having raw sex with him? Yeah. So what is his motivation for giving it to you, sis? That's just like telling your child, you don't get this job, you ain't gonna get no another pair of Jordans, but you keep buying them Jordans. When you think they don't get a job? Never. Okay, same concept. So make sure you're seeing their STD testing. Okay. Now, a lot of this might seem like a buzzkill, but let it seem like a buzzkill because you got family to deal with. You ain't trying to be a burden to nobody. So listen. Okay. So make sure you're seeing their testing and make sure you're providing yours too. Because if you having sex with somebody and they want to hit it raw and they don't know nothing about you, that's your red flag because he did that to the last woman and the woman before her and the woman before her, and you don't know what is coming down the pike. So he really should have some questions about you too. Like, yeah, so you go to the gynecologist, you make sure you get checked out on the regular, all that down there is all right. Okay, well, you got some paperwork, you got some receipts. Everybody should have receipts. I'm just saying. You can go to the health department, you're gonna get a receipt. They gonna show you some results. They ain't got no insurance, go to the health department. They a veteran, go to the VA. They got a little couple of dollars, but don't have no insurance, go to the urgent care. They got insurance, go to your primary care doctor, but somebody can go everywhere. Anybody can go anywhere to get some stuff done. Okay, so that is the primary thing. But yes, they plan in your face with some of these fake results. Now, let's say you really like somebody. He really does not have a way. We ain't judging nobody. He might be between blessings, girl. And he really does not have a way to get tested. You really want to, outside the fact that we all should be using condoms. All should be using condoms, point blank, period. But, a situation arises. This comes up, that comes up. Okay. Again, we listen, we don't judge, and we help the next sister over here. Okay. Now, there is at these little stores, at these little like fake pharmacy, not fake pharmacy stores, like the Walgreens, the CVS, all these places. They have an at-home HIV kit. Now, this might be a killjoy, but baby, worry about them test results is even more of a killjoy. Okay, so they have the at-home HIV kit. So it's a set of two. So you swab your jaw, he swabs his jaw. Everybody's dropping. You drop a little couple drops on the Q-tip, 15 to 20 minutes. If it turned blue, he got the HIV. I ain't got to pick up your stuff, and get the getting, but, sit and have a little conversation, pull your clothes together and act like you're real concerned as to the situation, but, watch yourself. Okay. So there is that. The next thing that, again, y'all can be hearing me. Y'all can be hearing me now because I don't want to graze past the condoms. That's very important because at a certain age, y'all do realize that HPV is the only, and cervical cancer is the only sexually transmitted cancer. So yeah, it's not just gonorrhea, chlamydia, trichomonas, and HIV we're worried about. Hold on, y'all. I gotta take care of my Instagram followers too, because they're having some problems with connectivity. Y'all all right over there? Y'all okay, girls? Okay. We're also worried about HPV or human papillomavirus, so we don't want that. If we like, child, I'm past that stage in my life. Okay, you might be. Now, let's talk about HIV prevention medications. I don't know if you guys know, but there is medication that you can take. There's a shot that you can take every 2 months in your butt cheek. Yeah, she's real. She's like that long Depo needle. But hey, listen. Or you can take pills every day for HIV prevention. And the pills are 98.7, I believe, percent effective. And the shot is even more at like 99 and some change percent effective at preventing HIV. Okay. So Yeah, that is a thing. It is real. It is out here. It is not for gay people. It is not for trans people. It is not for wild people. It is not for hoes. It is for anybody who is having sex with another human being. I have NBA wives who are taking it. I have rappers' girlfriends who are taking it, baby. You can only control your behavior. You can only control your body. So at the end of the day, it is not a matter of, oh no, I trust him, baby. I tell people all the time, I'm sure he is trustworthy. You're dating him. It ain't his trust I'm concerned about, it's his health. Point blank, period. I'm just saying. So yes, between HIV prevention meds, because they're out there, between HIV prevention meds because they're out there, between making sure you're seeing his tests, providing your test to him. And then also, I be wondering, do y'all ever be concerned? Maybe some of y'all don't know the X, but urologist. Do you know what a urologist is? Yes, it is somebody who specializes in the male urinary tract from their kidneys down to their bladder, their balls, their prostate, their penis, everything. The name of the shot is Apretude, APRETUDE. Yes, evaluate it, investigate it, and get on it. Yes, girl. I believe so much in this. I'm about to start speaking for their company. Like, y'all know, I don't play around in anything I don't believe in. So yes. So the point is that, girl, what was I talking about? What was I talking about? Y'all know what I was talking about? Anyway, HIV prevention medication. So like I said, the pill daily, the shot. I'm all about the shot. So you need to be making sure you're protected from HIV, making sure you're using condoms, making sure you're seeing results and they're seeing results. Now, in a 64-year-old woman, I'm going to be very clear and saying you might have a little bit of vaginal dryness, mamacita. You might not, because the vagina is one of those things, you don't use it, you will lose it. Okay, so you don't use it, it will shrink on you, like the size of it. Like, you can't get no 8-incher in there no more if you ain't using it. Okay, somebody got to play around with little 3 inches and then work their way up. Okay, so that's how the vagina is. And sometimes, because we're dealing with menopause, I was talking about a urologist, that's right, because we're dealing with menopause, we may have vaginal dryness. Okay, and I'm going to get into that in a second. Let me go back to this urologist thing that I forgot about. So a urologist specializes in the male situation, and whether he has a problem, whether he does not have a problem. I tell people all the time, he has a whole appendage, a whole situation, a whole 2 balls and a penis hanging from his body. He ain't seen nobody about that. He ain't seen nobody about that. He ain't looked into that. He ain't feel like he wanted to have a specialist just check it out. He been using it for a long time. He ain't feel like he want. I don't like it. It's giving dirty to me. It's giving dirty, or it's giving just not knowing any better. But now you can put that on him and be like, so when last time you saw the urologist? A lot of them don't like to go to the urologist, and let me tell you why, girl. A lot of them don't like to go to the urologist because they be like, he ain't sticking no finger up in my booty. True that. True that. I get it. I get a little homophobic to me, but I get it. So the deal that I made with my ex baby daddy, I used to be like, okay, here's this. You go to the urologist, you don't, okay, so if the only reason you don't go to this doctor is because you don't want nobody to stick their finger up your booty, and the reason for the finger up the booty is prostate, to see if it's enlarged. You can get a blood test called a PSA. Okay, so the blood test is a PSA. P is in Peter, S is in Sam, A is in Alpha. Okay. And if that test is abnormal, that means that something's going on with the prostate. It don't have to be prostate cancer. It could be an enlarged prostate, could be a prostatitis, which is an infection of the prostate, inflammation. I don't know. But if the number is abnormal, baby, run on over there and let them people put their finger up there. Now you can ask them to put a pinky up there, but run on over there and let them people do what they need to do to get you straight. But the agreement was, but if the PSA is normal, then 9 times out of 10, your prostate is normal. And if we want the exam, so we don't want you foregoing. We don't want you foregoing the exam. I'm sorry, Instagram, you're having some problems up there. So there's that. Now, somebody asked about Avexapel, which are the bioidentical hormones I use, which is going to play right into Mama's situation as far as the vaginal dryness is concerned. Okay. And so let's talk about it. And somebody spelled Apretude, but let me respell it. It's Apretude. Apretude. Okay. So let's talk about this. Now, when it comes to, you have premenopause or perimenopause, menopause, and postmenopause. Okay, and I'm gonna break this down. And I need y'all ladies who like, I don't talk about no menopause, you need to understand it. Because one, is gonna be you one day. Two, it might be you already, and you just don't know. And then three, you need to understand the older women who are around you and what they go through. So I want everybody to be listening because I want y'all to be in the know. Okay. So now, when it comes to perimenopause, menopause, and postmenopause, the only significant difference is the period, and I'll tell you why. Perimenopause can occur at any age. The average age of menopause is 51, right? You have some women who go through menopause at 40. You have some that go through at 46. You have some that don't go through till 56. Okay. So, how do you determine technically menopause? What is menopause? So, we have menopausal syndrome, which is where you have all the symptoms, right? And we'll get back to what the symptoms are. So, you have menopausal syndrome where you have the symptoms. Then you have so perimenopause is before you stop having your periods. Now, oftentimes women in perimenopause skip cycles. Like you might go 3 months without a period, then boom, you have one. That period might last for 2 weeks. Okay. Yes, honey, brain fog is real. You see me over here. It's time for my pellets. So you have perimenopause, and you may skip. You may skip 3 or 4 months, and then may have a week long period. You may skip another 5 months and have a 2 week period. You may bleed 3 times in a month. The bleeding is just random in perimenopause. You can bleed at any particular time. It's just random, right? But menopause is when you have not had a period for 12 consecutive months. Even if you don't have a period for 11 months. If on that 11th month you start a period, baby, you got to start your count all over again. But if you don't have a period for 12 straight months, for 365 days, that 366th day, that is your menopause day. Menopause is one day. It's like an anniversary. Didn't know that, did you? Yes. Menopause is one day. So you got perimenopause, all the stuff leading up to menopause. Now, all the symptoms are the same. No matter where you at in this thing, the symptoms are the same. Let me be clear. It's the period. So no matter how much you skip, no matter how erratic it is, if you have had a period within a year, you are not menopausal. Okay. Once you hit day 366, okay, 366, boom, that's your menopause day. The day after that, you're technically postmenopause. Why is that important? It's not important to you as a patient because the symptoms are the same. It is important to me as the gynecologist. Why? Because once you have not had a period for 365 days, if ever you bleed after that, it is endometrial cancer until proven otherwise. So if you having all these erratic periods and you haven't gone for a year, I don't care. You're perimenopausal, child, don't talk to me about that period. I know it's a mess, girl. It's a mess. Okay. But once you cross over that day and it's 365, baby, I'm doing endometrial biopsies. I'm getting ultrasounds. I'm doing labs. I'm doing stuff. Okay, so that is the difference. Now, the symptoms of perimenopause, menopause, and postmenopause, again, are all the same. What it could be temperature dysregulation, hot flashes, and night sweats, two totally different things. What is it? The night sweats is under the cover, over the cover. You keep one leg under, one leg go under, what, but, back and forth until you freeze, and then you put it underneath. Child, it's a mess, and then you really can't get into a good darn deep sleep until it's time to get up in the morning. Okay, which then plays into fatigue, which fatigue is a part of menopause or perimenopause or menopausal syndrome, as I call it. Fatigue is a part of that in and of itself. So you just tired, worn down, and run down in general. And then it don't help that you don't get a good night's sleep. Okay, because poor sleep is a part of that as well. And that is difficulty staying asleep or difficulty falling asleep or difficulty getting a good quality of sleep. Got it? So between fatigue, poor sleep, temperature dysregulation, which we talked about the night sweats, but a bit of hot flashes. Let me tell you what happens with a hot flash. You just be minding your business somewhere, thinking you cute. You done got your little silk press done or your edges are laying, whatever it is. And just out of nowhere, Lucifer opens his mouth on the back of your neck, and it feels like somebody just opened the door on the oven with the Thanksgiving turkey in that oven. And the way that hit heats you, the way that heat hits you, and starts from here and goes to here, or starts from the feet and goes to the head, and there's nothing you can do about it. It's like once the train is in motion, baby, that thing is in motion. Ain't nothing you can do about it. And I tell you, if menopause don't make you get right with Jesus, nothing will. Because that heat that you gonna feel, that if that's eternity, no ma'am, no ma'am, sign me up for the 10 Commandment program. No ma'am, I can't do it, and neither can you. I'm just saying. Okay. So when I see the women, they sweaty, they clammy, they walking all around, they doing this all the time, baby, excuse them, and give them grace. And if you got some ice water, pass it to them. Give them grace. Okay, I'm just saying. All right. So between the temperature, the inability to sleep, between the brain, let's talk about the brain fog. Let's talk about it. Y'all see me on here, right? Okay. And then you walk into a room and you're like, what the hell I come in here for? You literally got to trace your steps. Like your brain is blank. Like you have no idea why you literally walk into the room. I have gone upstairs in my house before, and I live in a townhouse, and I hate going from the first to the third floor. I have gone to the third floor, went up there, did 3 things that I did not plan to do, came back downstairs and didn't do the one thing I went upstairs to do. Like that. You walk into a room and you like, what I came in here for? Yeah. Like I was just talking about, I said, what was I talking about? And literally drew a complete blank. It's so embarrassing, but it is what it is. So then let's get to the other stuff. Let's get to the how you feel. You feel very negative. You don't feel positive. You don't feel cup half full. You feel cup half empty. You don't really want to give nobody grace. You want to snatch somebody up and be like, yeah, because she like that. That's how she act. Rather than being like, well, she might be going through a lot. Like, let's give her some grace, y'all. Let's see how we can help her out. That ain't your ministry. You ready to get all up in somebody. Okay. So there's that. There's also sexual stuff. That's especially sexual stuff. So first of all, oh, did we talk about the midsection? Did we talk about the midsection? Yeah. And with menopause, it's one of those things. You can be going to the gym. You can be eating right. You can be doing all the things. But your body is like, girl, you said you wanted to lose some weight. Oh, oh, you did. Oh, I thought you said that. We're not doing that today, tomorrow, or the next day. So you could be doing all the things. You might lose 1 pound a week, whereas before you would do all those things in the gym and you would lose 7 pounds in that week. Now your body is like, girl, who? And that midsection is midsectioning. Okay. But don't put one of them waist trainers on, because baby, you're gonna catch on fire out there. You messing around these folks' streets, you're gonna be on fire. I'm just telling you. I'm just telling you. So you got that part. All right. Now, when it comes to the sexual stuff is a little bit different in the spirit of you really don't want to have sex. And again, think about this. Women who are going through this are 46, 47, 48, right? Think about this, y'all. And they have able-bodied husbands who are less than 50, who are 50, which I know it sounds old for some of y'all, but that's young. It sounds old for some of y'all, but that's really young. And now you like, I don't want to have sex. Don't touch me. I can't stand when oh Lord, don't let him roll over. And then it's like your vagina is like a 1975 deuce and a quarter. And if anybody knows what that means it takes a while to crank up. And when it crank up, it take a while to kick over. And so you likely will not get as wet as you used to. And it's going to take you longer to get wet. And a lot of times that's embarrassing. A lot of times it makes sex painful. And then a lot of women don't want to use lube. And I'm going to tell you which kind of lube to use too. But a lot of y'all don't want to use lube. So it becomes a whole, you're tired, you're cranky, you're hot and agitated, you feel sweaty all the time, your stomach is big. And, some of us are just like Anne, and some of us are very like, no, I've always been thin, and this is really bothersome to me. Some of us are just naturally thick, and it's like, girl. So, but at the end of the day, it's a sexual thing, and your husband, they don't get it all the time, even though they do go through male menopause. And check that podcast out. They do go through male menopause. It's not looked at as kind of acceptable for us. So we start to worry that now he feels like, um, he is not desirable to us. And then we got a thing, y'all. Then it's it. Mm. So it's a whole situation. So basically, I do bioidentical hormone replacement at my office. I use Avexipel, and it's Evexipel. And the way bioidentical hormone replacement works is it replaces exactly what your body needs. Exactly what your body needs. The reason it's bioidentical is because we draw blood. Like, I get a whole medical history. Tell me about this. Tell me about that. Have you had this surgery? Have you had endometriosis? Have you had fibroids? You got PCOS? Have you had a hysterectomy? Like, I go through the whole now. What symptoms are you having? Like, it's a whole, like a booklet. It's a whole booklet. And basically we draw your blood. And I wish I could say I was this smart, but I mean, I am smart, but not this smart. And then we put the information into like a format in the computer, and then the computer spits out, bam, this is what she needs. And sometimes it's estrogen replacement. It's not always estrogen replacement. All the time it's testosterone replacement. Can you believe it? Yes, girl, it's that girl. And sometimes it's progesterone. Often when it's estrogen, it's progesterone, because they play with each other. But the beautiful part about bioidentical hormone replacement is that we're replacing exactly what your body already makes. So your body naturally makes an estrogen called estradiol. That is what we're giving you back. We're not giving you no funky or special type of estrogen. We're giving you that. You already make testosterone. That is what we're giving you back. We're not giving you anything. Not progesterone. That's oral. That's at night. I like her because it's kind of like a little buzz, and then you just kind of go to sleep. But that is what we're giving you back. People say, well, is I'm going to have an allergic reaction to what's already in your body, girl? But I like Avexipel. There's another company that also did pellets. I did not like their pellets. I thought it was associated with weight gain. It made me gain weight, and a significant amount of weight. And I'm very sensitive. Like, if the wind blow and it's a possibility I'm going to gain weight, I'm going to gain it. I'm going to gain. That's going to be me. That's a side effect I'm going to have. Don't even worry about it. I'm going to take the weight gain for everybody. But I didn't like it, and their hormones were embedded in soy, which again I don't like, because soy is associated with weight gain. It's also associated with phytoestrogens, and that can be associated with breast cancer. So not my jam. Avexipel, I love it. Their pellets are embedded in wild yam root, and actually wild yam root, it actually works beautifully and beneficially for hot flashes, in addition to the hormones that you're going to get. So bioidentical hormone replacement is 2 to 3 times a year. You have these places out here doing it every 3 months, and and all the things. Yes, it was, honey. And Black Jackie Leo 7:30. Yes, it was, honey. But so you have all these, girl, again, off the subject, I don't forgot. But anyway, so I'm big on, doing my best for my patients, because when you have bioidentical hormones, it's done right. It is going to decrease your risk of cancer. It's going to help with bone thinning and bone mass. It is going to turn back the hands of time. It's going to help with collagen production. It helps with your cardiovascular risk factors. It helps with all of those things, and that's why I love it. And so, when it comes to, you have these places that are doing it, and they're kind of treating it like a money grab. I'm not judging the way anybody does their thing. Do you, boo? I'm just gonna do what's right for the patients always. It's every 4 to 6 months. It's based on your cardiac output. So the more active you are, it's gonna be closer like every 4 months. But if you kind of like, well, I might go to the gym one day. I mean, I might go walking, the whole 9 yards. I might. Then it's gonna be closer to every 6 months for you. It's not covered by insurance. But it is like maybe $400, $425, something like that, every 4 to 6 months. And it's embedded not in your booty hole. Somebody's like in your butt and your butt cheek. Okay, so we numb up a little area on your butt cheek. And the little thing to put it in is super small, like it's thinner than this ink pen. And we just kind of roll it in, drop the pellets, and the pellets look like pieces of chalk. And they are bigger than a piece of rice, smaller than a Tic Tac. And how many pellets you get depends on what calculation the computer tells us that you need. Some people get 137, some people get 150, some people get 162, some people get 175, and that's of testosterone. You might also get estrogen. So it really just depends on what you need. People always ask me about fibroids and hormone replacement. And it really, as far as the fibroids are concerned, it'll have an effect if you have to get estrogen. But if you don't have to get estrogen, then it shouldn't have much of an effect on the fibroids. And I've never had a patient to have any issues with fibroids. Now, perimenopausal patients and fibroids maybe, but once you're postmenopausal, your fibroids are supposed to be calcified, meaning they die off. The blood supply to the fibroids die. There's nothing for them to feed off of. But again, if you were to tell me, oh, I got fibroids, I probably would drop your dose of estrogen one, just to make sure we didn't have any bleeding or any random spot bleeding. But no, you can get hormone replacement. So I love it. I feel like, to me, I feel like, again, I'm having some problems tonight with my brain fog, but the girl is a little bit tired and it is time for my pellets again. But I love it. I love it. It puts you in a place. It makes you happy. It makes you calm. It makes you settled. One thing that I will say about it is this, and I'm not even going, baby, when you get your pellets, it turns your libido into that of a 20 or 25-year-old. I'm not lying. You want to have sex with his man, her man, the FedEx man, the Amazon man. Baby, don't. If a woman say, oh, I just got my pellets, don't let that lady come over your house and kick her feet up under your table because she looking at your man. I'm telling you, if she ain't got no husband, I'm telling you, she over your house looking at, don't let them kick their feet up under your table when they say they don't have some pellets. If I got some Medea advice for you, let that be it. Keep them folk out your house, okay? Because they want to have sex with everybody. They wake up in the morning wet. They want to have sex all the time. That's all they think about. I done had husbands complaining. Can you ratchet it down some, bruh? I can't. Mind your business. I can't. This is between you. And it's so much so that a lot of women, one of the side effects actually is that your clitoris swells. Like people be like, my clitoris is like super big. Yep. That's why you're getting the results that you're getting. Yes, ma'am. Yes, ma'am. So if you don't have a rose or if you don't have a man, you might want to double think it. I know it's good for your health and everything, but I'm just telling you, you're going to be outside. Don't let these pellets get y'all. My mom, the one who wrote about the young man, my mom, don't let these pellets get you out your mind and you ain't asking the right questions because you're trying to bust down. Be careful out in these streets. This will have you outside. You hear me? So I'm just letting you know. So if you are not in Atlanta, if you are in Atlanta, come on and see me. We can get your pellets in expeditiously. But if you are not in Atlanta, all you have to do is go to Avexapel. I think it's avexapel.com. But if you put in Avexapel, it will take you to an Avexapel provider in your city and a certified provider who has gone through training, who understands what they're supposed to be doing, not just somebody popping in these random pellets. Because you got people out here bootlegging the pellets too, child. So not somebody out here popping in these random pellets. People who are using the Avexapel pellets if you're not in Atlanta. So if that's the space that you're in and that's what you need, girl, get it. Somebody also asked about yeast infections, recurrent yeast infections, and yeast infections that are not responding to antibiotics. Okay, so let's talk about this. There are 5 different types of yeast. People probably don't really know that. The most common type is Candida albicans, which a lot of times that's all the practices will test for. The next most common type is Candida glabrata. So you got some ones I can't pronounce, Candida parasilopolis, I don't know, but it's 3 other ones out there. If you got one of them 3, that's bad. That's when it's kind of in your bloodstream. That's kind of when you need to see infectious disease. That's when you sick. You sick, girl. So mostly what we're going to see is Candida albicans, Candida glabrata, and maybe Candida tropicalis. Those are the 3 that we're really going to see, and not so much Candida tropicalis. But anyway, people think that Candida or yeast comes from, can I spell what? Patrice _68. Tell me what you want me to spell, babe. I looked up here late. And yes, I'm going to tell y'all a good lube. Don't let me forget. Y'all see what this brain fog is doing today. But when it comes to the yeast, people think that hot, tight clothes, no, that worsens it. Yeast grows in warm, hot environments, but oftentimes you're going to see yeast when your blood sugar is high. Yeah, girl. So them carbs, that rice, that bread, that pasta, that uncontrolled diabetes, that undiagnosed diabetes, that pre-diabetes that you've been ignoring for years. Also, though, let me put y'all on to something. If you weren't listening, I need y'all to listen. You ready? You ready? If your partner, if the blood sugar, if his semen, the blood sugar is high, meaning he eat a bunch of junk, he eat a bunch of crap, he eat a bunch of carbs, eat a bunch of candy, or he got diabetes he's not treating, or he has undiagnosed diabetes. If you're having unprotected sex with him and he ejaculates inside of you, your vagina will respond with a yeast infection. Boom. Did y'all catch that? Y'all caught? Yeah, yeah, yeah. So oftentimes when I have patients who have recurrent, shipped, girl, no pellets can't be shipped to you. They have to be placed in your butt cheek at the doctor's office with special equipment. So yes, um, his semen can actually cause you to have recurrent yeast infections. So first and foremost, like I said, there are 5 different types. So when I, check for yeast, we're checking for all different types. Did you know that Candida albicans can be treated with fluconazole or diflucan or the pill, but Candida glabrata cannot be. So if you have Candida glabrata, you got to use turconazole cream. You got to use the cream because the pill ain't going to help you. So the question is, how many types of yeast do you have? Because you could have more than one type of yeast. So if they just treat in the albicans, that might be the reason that you keep getting yeast infections, because you might have the glabrata. So you might say to them, but albicans can also be treated with the cream. So I know y'all don't like the cream, but if you keep getting this yeast infection, you might want to say to yourself, doctor, can you please give me the cream? I need turconazole. Turconazole. I'm gonna need the turconazole cream. Okay. So there's that. All right. So, and then first of all, change your lifestyle. Drink some water. Okay. Slow down with those carbs. Make sure you know whether we're pre diabetic, diabetic, any other things. Just make sure you know, sis. Okay. Then we want to make sure we're being treated appropriately. And then we want to see what his behind is doing as far as his diet, as far as his medical conditions and his situations. Okay. So there's that. Now, what else can you do? What I also recommend to my patients, because we're going to jump on the holistic side of it. What I also recommend to my patients is apple cider vinegar capsules. Stop taking them damn gummies. Y'all is grown. Y'all is real grown people taking these damn gummies. They're 98% sugar and 2% whatever it is you're trying to replace. Okay. Go on to the Zon, aka Amazon, and get y'all some, or even the nearest health food store, and get y'all some apple cider vinegar capsules. It's literally apple cider vinegar powdered in a capsule. I say 2 a day. That's going to eat up any overgrowth of yeast that happens to be in your body. Okay. It also will help with like seborrheic dermatitis, like the white scalp stuff, all of the things. It will help with that. It'll help with weight. It'll help with appetite. It helps with so many things. Like apple cider vinegar is that girl. Okay. Now, but that's a little 2 cents about the whole yeast thing. Now, I did say that I was going to tell y'all what lubes to use. Now, let me tell y'all something. First of all, this is not a paid promotion. Hopefully soon it will be, because I'm going to take her money just like I would take anybody else's. But I'm only going to take her money if I believe in her product. If you know me, you know I don't co-sign nothing I don't believe in. Okay. But get a pen. I think they had tried to take her Instagram page down at some point. I don't really know the details, but it is called Officially Pleasured, and her website is officiallypleasured.com. But on Instagram, it was like Officially Pleasured XOXO, some underscores somewhere. But the name of the name of the lubricant is called Wet Kitty. Wet Kitty. Now let me drop some gems on y'all about Wet Kitty, because you might not have any vaginal lubrication issues. At least you think you don't. But you might want you a little extra, a little extra bag this month, a little extra change. Let me tell you how to get it. This Wet Kitty, first of all, it is odorless, colorless, tasteless. It comes in a bottle about that big. I don't know. It might have different sizes. I don't know. But either way, it has a dropper inside the thing, and you can actually insert the dropper into your vagina and squeeze the lubricant inside the vagina. Now, it will not cause vaginitis. It does not cause irritation. It will not cause yeast. The most important thing is it doesn't dry up and get sticky. It stays exactly how you put it on. It's going to stay there until you wash it off. So, excuse me, if you decide that, okay, I'm gonna put it on that night after I take my shower, and then y'all tired, y'all fall asleep, okay? And and you decide that you don't want to bust down till 3, 4, 5 o'clock in the morning, it's still gonna be just how you left it. And he gonna roll over and be like, oh, she was wet, she was waiting for me. Yeah, girl. So at the end of the day, it is all the things. It is that, girl, run to the website and get you some. And I usually recommend it to my patients. Soon I'll probably have it in my office. I'll probably carry it in my office pretty soon. So if you're my patient, if you're in Atlanta, come on by and pick up your stuff. But that's soon. That's not yet. But anyway, somebody asked me about apple cider vinegar. Can you just drink it? Yes. Some people have reflux. They can't tolerate it. Some people don't like the taste of it. So I just try to make it easy for the people. But if taking a cupful and not in your damn bath water, y'all fit. I'm about to be like that lady with the white shoes. Don't do it. Do not do it. Please stop putting salt products in your water. You're pickling your coochie and then can't understand why it's itching and dry like beef jerky. Well, because them folk told you it's salt. You put vinegar, you soak a piece of chicken breast. Okay, go ahead and soak a piece of chicken breast in some vinegar overnight and come down and see what it looked like in the morning, aka your new vagina. I'm just telling you, just from me to you. Some things in medicine are actually common sense. Most things are not, but some things are. So yes, there's that. A person has asked me about intraductal papilloma when it comes to breast cancer, microcalcifications. I'm very sensitive to discuss cancers because they're very personal, and every person's situation is different. And I would never give a recommendation on something that might be generally true but not true for you, and then your doctors have to fight back trying to get you to in a space where you're believing what they're saying. So please don't think I'm ignoring your statement. I see it. It's just that I'm so sensitive to cancers and making sure people get the appropriate care and that you're following your particular provider, that I will not comment. So please forgive me, and I hope that doesn't upset you, but it really is for your own protection because I don't have any more information that I can help you with. Somebody actually asked the name of it again. It's called Wet Kitty. Now. What else? I'm trying to make sure I didn't miss anything because I am going to get to this GLP-1. Which are the injectable, because I've been wanting to talk about this for so long, child. But the thing is people get so defensive, and people will believe a lot of stuff that they see. No, apple cider vinegar is great, girl. Who did you watch the last 2 minutes of this thing? It's wonderful. Anyway, I'm very sensitive about so at my practice, I decided to rename or rebrand what I do. I don't even like to call it weight management because that's not really what I do. I do metabolism management. I do metabolism manipulation. And that's how we get where we have to go. Now, as far as the weight loss shots are concerned, I don't like to be like, oh, yes, I like the shots, because it comes with a caveat. And I'm going to explain what the shots are and why they will work for some people and while they will not work for others. No, never soak in apple cider vinegar. Don't soak in anything. So let me just explain how they work. So first of all, when you have a GLP-1 is a long word for like a hormone in the body. And what GLP-1 does, it does two things. It makes you feel full fast, and it makes you stay full longer. That's all it does. That's all it does. So what the shots actually do are, the shots are like, hey girl, hey, I'm going to fill you up. You're going to feel super full, and you're going to stay full for a long time. And so what they do is they prevent you from overeating. They prevent you from eating a ridiculous amount of food because you're full. And a lot of people be like, oh, they make me sick. I was nauseous. I threw up because you tried to over damn eat. Yeah, it won't let you overeat. Yeah, you out here sick because you're overeating. Okay, so there's that. And how I explain this to patients is this, because if you are taking these shots, first of all, you got to be on the real shot. All that compounded stuff, I don't let my patients do that. I don't know what they compounding. I don't know what they're mixing with. You don't know what they're mixing. Y'all was so damn scared of the COVID shot, but y'all grabbing these fat shots and injecting God only knows what the hell into your body. Okay, you're going to be Rasputia in about 5 years and ain't got nobody to blame but your damn self. Now, let's move on from that because it ain't about that. But the point is that if you are not approved for the actual real shot that comes from the company and a box of 4 jet syringe, I don't want nothing to do with you. Okay, we can do other stuff, and then everybody is not going to benefit from the shot. And I'm going to tell you why. So here's what the shot does, guys. So let's say before the shot or when you first start taking the shot, you eat 10 lemon peppers, some french fries, and a strawberry Fanta. You can see that I've had experience with this meal. I judge not, and neither should you. Okay, good. When you start taking the shot is going to back you down to maybe 2 lemon pepper wings, maybe a couple of fries, and maybe a sip of that strawberry Fanta. So obviously, over time, you're going to lose the weight, right? Because you've gone from 10 to 2. You're going to lose the weight. But what the shot does not do, it does not alter your metabolism. It does not alter your taste buds. It does not help you change your lifestyle. It does not do any of those things. It only decreases how much you eat. So now when you see these people who they done lost all the weight on the shot, they look all sunken, they look all sick. You're right, they do. Why? Because they don't have a plan. What does that mean? Okay, that means that they're essentially starving themselves to death. They're starving themselves to death, and that's how they're losing weight. Is that going to sustain? No. Are they going, as soon as they stop the shot, are they going to get fat again? Yes. And fat is not meant to be derogatory. I apologize if anybody take offense to it. Are they going to gain the weight again? Yes. So in my program, this is how I manipulate and I deal with the shot. Okay. First of all, everybody is not overweight for the same reason. You have some people where it's due to medications. They're going to lose in one way. You have some people that are just simply due to overeating, whether they realize or not, they actually have an eating disorder, binge eating, whatever, they have eating disorders. Then you have people who are insulin resistant. All 3 of these people are going to lose weight in a different way. Depending on what eating disorder you have, and if you're just a straight up overeater, the shot is going to be your friend. Okay. But if you are insulin resistant, pre-diabetic, any type of, the shot might make you lose 1 or 2, maybe 3 pounds a month, but that's not the medication you need to lose weight. And no, I ain't gonna tell y'all which one it is because you can always come to Atlanta Premier for metabolism management. But that is not going to be the primary thing that helps you. But no matter what it is that you do, you have to change your life. So based on your metabolism, your body is looking for something. Your body is looking for a particular way to eat based on your metabolism. And let me give you insulin resistance as one. Okay, so if your BMI is greater than 36, girl, you insulin resistant. Girl, you just are. Come on over here. Come on over here. Come on over and have a seat on the bench with the rest of us. You insulin resistant, period. Okay, now, if this happens to be you, the shot is not really going to work well for you. When you're insulin resistant, how much you eat is not as important as what you eat. So when you're insulin resistant, girl, stay away from them carbs because your body can't handle them. Your body don't like them. Your body can't break them down. Stay away from them. That's why all this midsection, all that big backedness, all this up here, them is the carbs. Okay. So stay away from that. Your body does not like it. But let's say you are insulin resistant. You can have a table full of protein and vegetables. You can have salmon, crab legs. You can have lamb chops, salad, collard greens, you can have a whole table full. You're not going to gain a pound. You can eat 2 donuts. You're going to gain 2 pounds. You get what I'm saying? So it's not about how much you eat as much as it's about what you eat. So in somebody like that, the shot is not really going to help you because even if you are controlling how much you eat, but because you can control it. Because people who are, generally insulin resistant, they always make excuses. I don't eat a lot, but you don't just had 75 grams of carbs, but it was only in a little bit of a serving, but it was so much damn carbs. So this is what I'm saying. So everything doesn't work for everybody. The shot is not going to be a magic shot for everybody. You get what I'm saying? So some people you're going to see, great. Now my patients know you on a plan. I tell you what to eat based on your metabolism. This is what we're going to do. I tell you how to exercise, because if you're insulin resistant and you're lifting weights, you're gaining weight, sis. Boom, did I just drop it on you? I'm just saying. You're gaining weight if you're out in these streets lifting weights. I don't want to squabble about it. I'm just telling you. Ask my patients, they know. So I tell you how to exercise based on your metabolism. I tell you what to eat based on your metabolism. We dose your medication and it doesn't stay the same. It could go up, it comes back down, it goes back up. We add something, we take something away. Again, we're manipulating your metabolism to get your body to do what we need it to do. My job is to have you understand it and to teach it to you. So you don't need me. You won't need me forever. I don't need you dependent on me. It's enough overweight people in the world. When I fix you, come on, here come the next batch. Here come the next batch. You get what I'm saying? So my goal is to teach you, and no, of course diabetics will lose weight. It's just, and pre-diabetics will too, very easily. It's just you have to know what to do, and it's my job to teach you. So my job is to teach you what to do and how to do it. And forever, when you learn it, you'll be able to implement that. You start to gain a couple pounds, you're gonna be like, oh girl, I can fix that. Oh girl, I got that. So please know and understand that no, any and everybody can lose weight. It's just we all lose weight differently. And this is why sometimes, and shout out to the trainers that know what they're doing, which is not that many of them, but this is why sometimes I get pissed off, because they train everybody the same and they train people based on how they lost weight. No, your metabolism is different than hers. Did y'all know for every 1 pound you carry is 4 pounds on your knees? Did you know that? So for somebody who's 200 pounds, that's not a lot of weight. I don't know how tall you might be. Somebody might be 4 feet, 200 pounds. That's a different person than somebody who's 5'8", 200 pounds. But either way, 200 is 200, right? So if that's true, then it's 800 pounds on each knee, which means it's 1,600 pounds on your hips. A car only weighs 2,000 pounds, a small car. But nevertheless, it's 2,000 pounds. So I get pissed off a lot of times when you see these trainers who are out here like, you can do it, you can do it. You can do it. No. You can do it. You can do it. And then what ends up happening? You get discouraged. Well, no, she's 90 pounds. She's operating on a whole different space than you, who is 200 or 250 pounds. So don't tell her she can do it. Don't shame her because she can't do it. That pisses me off. So again, these are people who don't understand what they're actually doing. Does that make sense? So, anywho's, when we're talking about these GLP-1s and weight loss gets very complicated. That's why, sister had to go for some additional training and truly understand obesity medicine, because it's not as direct and straightforward as it sounds. And what pisses me off more than anything is these damn family practice doctors who just give you, here go the shot. Have fun with that. No, you're setting people up for failure. You're setting people up for failure, and that pisses me off. Somebody also asked me about intermittent fasting. So I don't have a problem with intermittent fasting. I tell my patients, if that's something that you're comfortable, a lot of patients like it because it creates structure, right? They know to eat between this time and this time. And okay, girl, go ahead. But if it comes to weight loss, right? If it comes to weight loss, the actual only method, because most people are going to do 16-8, right? 16 hours off, no eating, 8 hours on. But the actual, they did research, and they said the actual only method of intermittent fasting that actually works is the 5 and 2. So that is when you do whatever you want, and then for 2 days a week, you completely fast of anything other than water. And that's the only one that makes you lose weight. Now, if you in these streets turning down your plate before the Lord because you searching for answers, that's one thing. But if you just like, oh, I don't eat Tuesdays and Wednesdays, to God be the glory, and that's baby. You got the strength of Goliath, because not me. By 11 o'clock, I'm hungry, and I gotta pray about it and try again tomorrow. Okay, that's part of my problem. But that is the thing. Somebody asked me, how do I feel about Weight Watchers? Weight Watchers is big on counting calories. And again, if you are a pre-diabetic, that's not going to work well for you. You have to count your carbs. I usually tell my patients no more than 20 net carbs a day. Please Google how to calculate a net carb. Okay. So I will tell my patients no more than 20 net carbs a day. But your Weight Watchers and a lot of these other programs from back in the day, they're calorie watchers. So people kill me. Oh, it only has 100 calories, and you eating a damn pack of Chips Ahoy, the little small little snacks. Yeah, it only got 100 calories, but it got about 35 net carbs, and you can only have 20 in a day. So you just gain weight by eating that little bit of a little something something. So you have to understand. That's why I said metabolism management is really the issue, not weight management, because you have to understand why somebody is overweight and combat it. Like because obesity is a disease, and so you have to combat it. Like, oh, okay, this is the reason that your body is technically sick or overweight. I know what prescription you need to fix that, and that is more anything how weight management works. Okay, girls. All right, girls. So it is now 8:30. I have to work tomorrow. So I'm going to have to jump off of here. This was so fun. Somebody did ask about my soap, and I'm going to say that. So first of all, the Clean and Cute body wash bar. Who use it? Who use it? Show of hands. Show of hands. Who uses it? I can barely keep any in my own damn house, and I make damn soap. So yes, it is. And again, it was purchased. It was developed out of necessity, right? Everything I do is developed out of necessity. Every product that I have, I developed because people were having issues. So one of the rules in my practice when it comes to vaginitis is you cannot use liquid soap. You cannot shampoo your hair in the shower. You cannot use liquid soap. I don't care how organic, vegan, non-GMO, natural. I don't care who made it. I don't care if it was made with the tears of sweet baby Jesus. If it is a liquid, you are going to get a vaginitis. Point blank. Period. That is one of the rules. I ain't willing to listen. Okay. And so, but the girls were very, I know, doc, I know you telling me to use the soap. I know I'm supposed to use it, but it just don't smell like nothing. I just be getting out the shower. I don't be happy. And I thought about that. I said, okay, what can we do to help the girls? And I thought about all things. I thought about our stretch marks. I thought about areas of hyperpigmentation. I thought about dry skin. I thought about eczema. I thought about the bacteria that actually live on the skin, the staph and the strep, because y'all know I'm all about killing stuff. I'll be killing stuff out here. I'll be playing with it. So I thought about all these things. The different people be having like the little spots. Those are fungal infections. I thought about all of those things, and I developed a soap. My stuff is all natural. I got to get in the lab. If you don't know, and if you're new to me, my undergraduate degree is in chemistry. So I get into the lab and I come up with the preservatives that are going to kill the infections or the staph, the strep, the funguses, all the things that live on your skin. And then I implore different essential oils and different oils in general, carrier oils and different oils that are going to help with your skin issues, your dry skin, that are going to hydrate, that are going to moisturize, that are going to help with stretch marks and hyperpigmentations and different things like that. And then I put an essential oil, like literally no perfume, no fragrant oil, an essential oil that is so fresh. It just smells like, it really smells like when you on one of those little remote islands, girl, and you just in an outdoor shower. It just smells so fresh and clean. Like your whole master suite will smell like it. I'm in love with it myself. I snapped. People usually get 6 and 12 packs at a time. She's not cheap, but the girl is handmade. The ingredients are all natural, and it really does help your skin. You will notice a difference in your skin. It is on my Instagram at Clean and Cute Wash or Clean and Cute. Cleanandcute.shop is the page, and I believe the link is also in my bio. So you can do that. We're actually coming out. I'm going to spin out this week some pictures. We're actually coming out with the eczema soap. The eczema soap even smells good. And again, people are like, oh, there's a bunch of oatmeal. Baby. Who? Where? Who put a bunch of oatmeals and oats? No, girl. Your girl got in the lab. And again, figured out what happens with eczema. The skin is cracking. We got to protect it from infection. We got to prevent it from cracking. We got to get the appropriate oils in there. We have to get the appropriate chia seeds, yeah, girl, in there. And I mean, I just snapped. The soap I just snapped. And I love it, and I think you guys will love it. We were sending out samples to some people, people who are already customers at Clean and Cute, and then people who are my patients who have eczema. We were sending out samples, and I'm about to roll it out now. So I'm very excited about that. Again, everything I do solves a problem. You want to look at the entire line. Again, go to my Instagram, Clean and Cute Wash, or the page cleanandcute.shop. And I appreciate you all. Also, don't forget, y'all better get the survival guide. Get it, learn it, read it, understand it. And although it's telling women who are trying to get pregnant what to do, what not to do, like y'all don't be knowing this hookah decrease your fertility. Yes, it does. All that is in the survival guide. So y'all best to get it, okay? Anything that I make, yes, you can use on children. I don't recommend children under 2, but 2 and over, yes, you can use the soaps and things like that on children. Absolutely 100%. So guys, I'm going to dip off. Thank you so much for joining me. I love y'all. I appreciate y'all comments. I tried to read as many as possible. Normally I had my team here with me, but they were busy. So I navigated these 2 things myself. And again, somebody is asking me about the site. I don't know if that's delayed, but yes, I'm an OBGYN, my dear. And it is cleanandcute.shop, cleanandcute.shop, cleanandcute.shop. If you're on Instagram, it is cleanandcutewash. All right. I love y'all to pieces. And until next time, I see y'all. And again, Thursday, I'm going to do a video. I think I'm going to do I done a podcast on PCOS, but it wasn't giving what it needed to give. It was too much here, not enough there. And so I'm probably going to retape and go up and put the whole video up on PCOS on this coming Thursday. Okay. All right, girls. So thank y'all for joining in. I love y'all and appreciate y'all till the end. And like, share, subscribe, and just share. Make sure everybody get all this. Don't be gatekeeping, y'all. Okay. All right. Love y'all to pieces and have a wonderful evening. Bye. How to stop this? Okay.